And good evening, Florida, officially. Greetings of solidarity and health from the land of 10,000 lakes. Well, again, thanks for having me. I am absolutely thrilled to be here. As Stefan said, I am the national coordinator for the Labor Campaign for Single Payer and chair of Healthcare for All Minnesota. So tonight, I'm going to focus my presentation on the work of both of those organizations. But before I do that, I want to say to Jim, you're right, nurses rock. They're absolutely amazing human beings. I was honored to end my career representing them. But I want to just do a couple of slides to sort of ground us all in the reality of what's going on with our current so-called healthcare system. So for a glimpse at this landscape that we have called healthcare here in the United States, all we have to do is look at some of the current headlines to see where this system is focused. And trust me, it's not on patient care. If we learned nothing else from the horrors of the COVID-19 pandemic, we certainly learned that health is indeed a public good, not a consumable good, and the insulting question of who deserves health care was definitively answered. We all do, because we're human. That's it. It's that simple. A Minnesota nurse during the peak of the pandemic wrote a blog about what she was experiencing. And I just want to read a couple of lines from that blog. She said, "If I die, I don't want to be remembered as a hero. I want my death to make you angry too. I want you to politicize my death, use my name to shame those who have profited or failed to act, leaving us to clean up the mess. Don't say heaven gained an angel. Tell them negligence and greed has murdered a person for choosing a career dedicated to compassion and service." I say amen to that. Dr. Elizabeth Rosenthal, in her book, American Sickness, How Healthcare Became Big Business and How We Can Take It Back, sums it up by saying transformation of American medicine in a little more than a quarter century, from a caring endeavor to the most profitable industry in the United States, the medical industrial complex has made money the metric of good medicine. We have to recognize that the healthcare marketplace is profit-driven, it's dysfunctional. Healthcare is a basic human need and a public good for all people, and not a consumable good or a business for the purpose of profit. So, oh, darn, there we go. All right. And yet here we are, right? So the way we deliver healthcare in America is broken and it's getting worse. We all know what the problems are. It's just that our solutions have actually made it more difficult to get care. And again, we're using business strategies that maximize profit and not healthcare strategies that actually maximize health. So our solution, making it more difficult to get the care, are the things we were talking about earlier: limited networks, co-pays and deductibles, restricting what type of coverage, prior authorization nonsense, denials of claims. None of that has anything to do with healthcare. It all has to do with how someone profits by taking in more money than they're paying out. That's the only way you can make money when it comes to healthcare in the insurance industry, right? So these 40, 50 years of reforms have actually made it more difficult for us to get care. That's just crazy. So how is the Labor Campaign for Single Payer thinking about all of this? Well, first, I want to provide a little bit of information about who we are. The Labor Campaign for Single Payer is a single-issue organization within the organized labor movement in this country. Our affiliates include a number of influential national unions and state federations across the country. Our primary mission is to increase and coordinate grassroots labor support for a single-payer Medicare for all healthcare system in America, because we believe that healthcare is a fundamental human right and that the labor movement must help lead in the fight for healthcare justice. The Labor Campaign is proud of the accomplishments that we have made to date, which include passing and maintaining a strong national AFL-CIO resolution that supports Medicare for all, bringing more and more unions into the campaign, engaging in a nationwide network of organizations that are working on Medicare for all, and really just continuing to still be in the fight and to exist. So with that solid foundation, we are now focusing on confronting the status quo. We are in this all with everybody to fight the privatization that is happening inside of our Medicare, funds with Medicare Advantage. expanding and organizing more union support. We are working to engage younger workers and workers of color and activists and ensure that we are having meaningful debate and that this happens with all stakeholders who have to be welcomed at the table so we can create the space, even for those who maybe aren't yet on board with Medicare for All, to find out where we can find common ground to move forward. It's really an exciting time and an exciting relaunch of the labor campaign. So just to give you a little bit of an idea, a big part of that relaunch has included what I refer to as distributive leadership, meaning that we are looking for folks to jump in and help. This isn't about me. It isn't about any one of us. It is about all of us, right? So we're doing that by creating these working groups to help with the work of the growing of this organization and with labor's involvement in the Medicare for All campaign nationally. So I will tell you that you can reach out to me if you are a part of a labor union and you have an interest, even as an individual, in helping us on any of these working groups. We'll take you. Come on and help us figure this stuff out and grow the movement. Before I talk about, though, the future, I want to take a minute and share with you all a little bit, because you might not realize and know about this history, because we don't teach a lot of labor history in the schools anymore, right? But let's take a look at the long history that labor has with healthcare reform. A progressive era reform group known as the AAL, the American Association for Labor Legislation, lobbied for protective labor legislation and published critiques concerning pending bills back in 1915. The first campaign for compulsory health insurance in the United States was actually started by this organization. The group began studying compulsory health insurance in 1912 and produced a model bill in 1915. It forged alliances with other organizations and lobbied state legislatures in a campaign that seemed at first destined to prevail. For a time, even the officers of the American Medical Association joined the campaign. Then World War I intervened. Commercial insurance companies mounted a very powerful campaign of opposition, and the AMA changed its mind, and the entire episode ended in 1920 when the New York State Assembly killed the bill, and it never moved forward. Now, we have 1943 to 48, the Murray Wagner Dignal Bill. Well, that particular bill was a vehicle for national health insurance as well back in the 1940s. It was backed by the CIO enthusiastically, less so by the AFL, which had kind of a philosophical problem with the idea of national health care. But the AFL had a tradition of because the AFL had a tradition of the union being the social insurance provider for its members, starting with burial benefits in the 19th century. But by the 40s, even the AFL was backing a national solution. And you can see here this is an old postcard that was sent out by the AMA with the front depicting a physician at a home taking care of a ill patient, and then the back making a very common argument, right? We're hearing it today. You don't want the government between your doctor and your healthcare, right? So although many unions and the AFL-CIO continue to support a universal national healthcare solution, that approach was politically impossible in Congress after the 1940s defeat. This is the peak of labor's political strength in America. Union membership remains during this time at 30% of the workforce, and labor's legislative clout, combined with the moral authority of the civil rights movement, pushes Congress to enact universal health care for seniors and the poor. That's Medicare and Medicaid. It's not quite strong enough, however, to bring home national health care for all. The labor movement is divided at that time, with some unions believing that the collective bargaining-based health care is a union recruitment tool. So historical amnesia starts to set in, and the substitute means to an end. And now this has become an end to itself. So you can see the 40s, we're talking about it, the 50s, it starts to fade away. And the 60s, we start to talk about it a little bit more, at least for a segment of the population. So between collective bargaining for the unionized workforce and political advocacy for those outside of unions, the labor movement delivers healthcare for working families. The AFL-CIO's official position remains in favor of government guaranteed universal healthcare, but the power of the private insurance industry constrains labor's realm of influence. And almost imperceptibly, as union density shrinks, so does employment-based healthcare. So we're doing it a little differently here in America on how we provide healthcare, and it works kinda for a while, right? But then as the unions start to lose members to offshoring and employers' decisions to relocate manufacturing to countries with cheaper labor and toothless or non-existent labor laws, the ability of unions to deliver at the bargaining table also begins to erode. The medical industrial complex moves to the business strategies, not healthcare strategies, that are creating an environment for profiting over human beings suffering. The term healthcare crisis begins to make its way into the public discussion. Oops, sorry. For years, the industry has come up with some kind of scheme that they sell to us. Remember this history I just went through. In the 80s, we got the PPOs. In the 90s, we got the HMOs. In the 2000s, we got the ACOs. I say EIEIO, all of it is nonsense. The disease management movement towards healthy behaviors is supposedly going to make us healthy, but even the big daddy Kaiser is beginning in, especially in the late 90s and into the 2000s to realize that it's not going to decrease rates significantly. So it just becomes another gimmick to distract us from our goal of achieving healthcare for all. Although unions, of course, in the private sector, we're doing better than the non-unionized workforces, but we only represent in the private sector 8% of the entire workforce these days. So where they do exist, though, as I said, they are shielding working families from the efforts of corporations to completely dump healthcare costs onto our backs. But we know that it's continuing to happen over and over again. It's a failed strategy to think we can negotiate health benefits in this day and age anymore. And we have to be honest about this reality. The orange line is family premiums through 2021. The dark blue line there in the middle is workers' earnings. And then the lighter blue line towards the bottom is overall inflation. That is not sustainable. That gap, the alligator mouth, I can say that I'm talking to Floridians, right? Crocodile mouth, whatever, is our wages. This is what is causing wage stagnation for us. That is not good for us as workers, and it is not good for the economy as a whole. Even for those who have employer-provided insurance, 200 million claims per year are denied. The reality is the insurance companies are making money by denying health care. A Business Insider poll that was published not too long ago found that most Americans with employer-sponsored health coverage support switching over to Medicare for all, undermining the right-wing narrative that the U.S. public is wedded to this private insurance plan model. The survey showed that 59% of respondents who have employer-provided insurance said they would support switching their employer-based health insurance to a government plan under Medicare for all, as long as the quality of coverage would remain the same or improve. And we know that that is, in fact, what will happen. The poll also found that Americans on government-run healthcare plans, such as Medicare and Medicaid, are more satisfied with their coverage than those on employer-sponsored plans, which have soared in cost over the past 2 decades. According to Business Insider, 57% of respondents on government plans said they love their coverage. Just 41% of those with employer-provided plans said the same thing. For labor, even with the good work that we've done around healthcare benefits, these business strategies imposed on us by the insurance industry still exist. We still deal with copays and out-of-pocket costs and deductibles, limiting our choice to providers through networks. We're giving up a lot at the bargaining table, a lot of our clout and our bargaining chips to constantly try to negotiate this beast that actually is a common enemy for our employer too, when you think about it. And of course, we have lost tons of wages. We are giving that over to the health insurance industry, and it is setting us back. And this is the end result when our access to healthcare is being held in the hands of those bosses. Because this is the other thing. Why do we let our bosses control our access to healthcare? They use it as a weapon to divide and conquer us, whether that's retirees versus active workers, senior employees versus less senior. They constantly pit us against each other. Solidarity wanes, and in the end, we all end up losing. We know that healthcare is at the heart of every battle unions face today. So many contract disputes and campaigns are connected to health insurance. Who's going to pay what share of the premium? How much more are the copays and deductibles going to be? Employers are increasing the number of hours that are needed to work to qualify for coverage. Negotiations with the boss are the same really for all of us. We are the only country in the world that links healthcare to employment. You lose your job, you lose your healthcare. And the bosses bludgeon us with this benefit when it comes to exercising our right to withhold our labor, to go on strike, because once you're off the payroll, you're also off the employer's health insurance plan. We can't win this at the bargaining table any longer. It's a failed strategy, as I said earlier, to think we can. Our access to healthcare has become a weapon in the class warfare that we are all engaged in. No social justice movement has ever advanced in this country without strong support from the labor movement. Our job is to make healthcare for all politically possible in the labor movement. And just let me ask you this question, whether you're part of labor or not. I think I'm talking to folks who will get this. If you're a worker, you're a retiree, you're just a human being, what would you, if you could, how would you use your values to actually create a $3.3 trillion, because that's what it's costing these days, healthcare system? Would we not want it to be universal, cover everyone, be truly affordable for everyone, be accountable so we know where the money is actually going, be accessible, no more closing down hospitals in rural areas just because it's not profitable for the big corporate health system that happens to own that particular facility? It has to be comprehensive. Everything that's related to our health has to be covered. It has to be high quality, and that quality has to be evidence-based. And of course, it has to be equitable. All means all, with no exceptions. And what would be the advantages for workers, right, under a Medicare for all system? Well, it would include, as I said, the elimination of bargaining over our access to healthcare. We could start using our bargaining clout to move off of wage stagnation, pump up and maybe restore defined benefit pensions so workers could retire again with dignity and economic security. We could improve our working conditions. We could negotiate childcare and elder care, things that have changed in our society now for us as workers. Union versus non-union workforces become much more competitive, with the cost of healthcare being equal and more comprehensive coverage for us all. As you can see by the union logos on this particular slide, a majority of workers in the largest unions across this country support Medicare for all. So these are the questions we're all thinking about right now. Love to have you think about them with us. How do we get labor support and more engagement by labor? How do we make it a political priority for labor and get labor to resource the campaign to win it? What are the obstacles? Why do they exist, and how do we overcome them? We've got some answers to that. How can labor activists work with others in their unions and communities to advance this demand and to win healthcare justice for everyone? And we got to move it up, move it down, and move it out, right? Bring in the union leaders, bring in and engage rank and file members to really create this campaign to be centered around worker power, and leaders and union members together have to connect with the broader community, those who are most harmed by this really, really dysfunctional, immoral system, so that together we can actually win the healthcare justice that we all deserve. Organized labor does deserve kudos for the work that they've done over many decades to secure better health benefits for workers covered by a union contract, but we're all still held hostage by this industry that has the audacity to think that they know more about our treatment than our very providers do. From a labor perspective, we know that our employer-based healthcare system is a convoluted mess. We have to take this out of the power of the hands of our bosses. It has resulted in a huge transfer of our wealth as as workers to corporations, causing the bosses again to use this as an economic weapon against us. It disincentivizes entrepreneurship, career movement, and advancement because we're all afraid to lose our access to healthcare. That's why the Labor Campaign for Single Payer is working hard to bring more labor unions into the healthcare justice movement, because trying to bargain this is not going to work. We're strategizing transitional moves that bring us closer to Medicare for all. It's pretty simple. In other industrialized nations in the world who provide healthcare for all their citizens, to all their citizens in some way, the unions in those countries have figured out that they can't keep their own healthcare benefits without everyone having healthcare. Movements ebb and flow, but the fundamental forces driving the healthcare crisis in the US remain. We have made great progress injecting this issue back into the mainstream, with a majority of Americans now supporting Medicare for all, but our primary mission still remains unfulfilled. With very few exceptions, labor has not moved beyond what I would call resolutionary politics, but they have to do that. They have to take it up as an existential fight, prioritizing it, resourcing it, and move on to revolutionary politics. The labor movement has always been, as I said, at the forefront of social justice movements. This one is no different. Labor is uniquely positioned to lead the way for Medicare for all, and it is our moral imperative to do so. It is truly the ultimate act of solidarity amongst us all. I'm going to switch it up a little bit now with my last few slides. And because Stefan asked me to talk a little bit about the work we're doing in Minnesota, since we are kind of one of your sister affiliates in the sense that we are also trying to think through a state-based single payer plan. I want to take a minute to just go ahead and talk to you a little bit about some of the work we're doing here in Minnesota. I want to note that on this slide are examples of all the fun ways in which we are interacting with our communities to help educate, agitate, and organize Minnesotans and various organizations and even businesses to join our campaign to win the name of our bill, which is the Minnesota Health Plan. And we're doing that through educational forums, town halls, we're tabling, we're marching in local parades, and we even staffed a booth at the Minnesota State Fair where we literally talked to thousands of fairgoers about healthcare reform. And it was really, really fun and interesting. As I said, our state-based plan is called the Minnesota Health Plan. It is governed by specific principles that are focused on public health and well-being, not on profits and politics, and ensures that providers and patients are in control of medical decisions, not insurance company algorithms. So you can see here the main points. They're the same as the Medicare for All bill, right? Cover everybody, all of the medical needs. We get to choose our doctors and hospitals, not a network dictated to us. Reduces costs by cutting administrative fees and waste, not by denying care. It's affordable to everyone, so it's based on income. It focuses on preventive care and makes sure providers are paid well and are paid in a timely manner. And it's a simple, understandable funding and payment system. Wouldn't that be lovely? To give you a little peek at some of the work that was just done in our recent legislative session here in 2023 in the area of healthcare, there were bills that were passed that begin to build the infrastructure that we are going to need in order to implement the Minnesota Health Plan down the road. Those include, we're getting a cost study done that compares the Minnesota Health Plan to the current system. This is huge for figuring out, as Frank asked, how we finance a state-based healthcare system. There are a couple different ways in which to do that, not terribly different also from the federal, but we've got to figure those pieces out because there are some complications to a state level that is different. It would be better for us to do this nationally. There's no question about that. We are now covering our undocumented friends, families, and neighbors under what we call the Minnesota Care program. It's a basic health program plan under the Affordable Care Act, because again, all means all. We are working to deprivatize our public health programs. I am telling you folks, there is no such thing as a public health program in this country. I can't find it. If there's one in Florida, let me know, because they're even here in very blue progressive Minnesota. all of our public health programs are privatized. Those managed care organizations have inserted themselves into our public health programs. We now have a prescription drug affordability board that's going to look at pricing around common drugs that people need to stay alive, right? We're going to get reports finally on the administrative waste that exists within our public health programs. And we know where that's going to turn out. It's all going to be about those managed care organizations that have infiltrated our public health programs. We are looking at the potential of whether or not we could develop a possible public option. And under Medicaid, medical assistance, which is our state Medicaid program, and I think this is really important. Carmen mentioned Medicaid earlier. Here in Minnesota, we pass laws. There will be no cost sharing for Medicaid patients. Got that? No cost sharing if you're in Medicaid. Children ages 0 to 6 will stay on Minnesota Medicaid, even if their parents, make a little bit too much money and tip themselves off of Medicaid. The children are still going to be covered until age 6. And children and young adults ages 6 to 21 are not going to have to do this onerous filing every quarter of tons of paperwork to prove they deserve to be on Medicaid. It will be just a one-time annual filing, and that will suffice. So those are some good steps, right, on our way to the what we hope eventually will be the Minnesota Health Plan. So the work really continues. But I do want to say that I think a strategy we've got to be thinking about is to begin implementing important tenets of the system that we want and deserve in a way that starts to create the conditions that we're going to need to make single payer possible, whether at the state or the national level. It's our best chance at winning healthcare reform, or healthcare for all. On a national level, that could be achieving things like lowering the Medicare eligibility age from 65 to 60, capturing the money that's being stolen by the privatizers, that's not being spent on healthcare, and use it to improve the current benefits within traditional Medicare, but also to cap those out-of-pocket costs that we were talking about earlier in the Medicare program. Senator Sanders is thinking about a primary care for all program, taking a segment of the system and showing how guaranteeing access to that segment, primary care, can be done both cost effectively and more efficiently, if not left to the privatizers to profit off of it. And at the state level, we should all be working to deprivatize our public health programs, expand them to cover more and more people, and maybe even consider breaking off a segment such as maybe pharmaceuticals. We got more power in the states than we think we've got to do some regulating of some of this stuff, whether it's insurance or even pharmaceuticals. So we should be thinking about how we can start to get creative and move in that direction. So some asks for you all. If you're a member of a union, as I said earlier, I want to ask you, what commitment can you make to help the labor campaign for single payer win healthcare justice for all? And if you aren't in a union, what commitment can you make to help your state or the national movement win healthcare justice for all? Can you get your union to affiliate with the labor campaign that includes maybe a financial contribution, and get your leaders and members and staff involved in helping us? Can you help us educate your union leaders and members on this important issue? Are you lobbying your congressional delegation to sign on to the House and Senate bills? How about helping to pass and implement that state-based bill? And what other community organization does your union work with that could be a natural partner for labor when it comes to healthcare justice movement work that we could do together? And if you're not a union member, let's be sure to stay connected to each other on the state-based efforts. Let's share ideas for transitional legislation that makes it clear where the problem lies, that within this really twisted and needlessly complex system, and that's at the door of the medical industrial complex, not at the door of the providers, the nurses, and the doctors in the system. It's critically important that we are committed to building a diverse, multi-generational, multiracial, multi-geographic movement, so there's room for everyone. So please feel free to come join us. I'm going to get you all these slides so you can read my notes and you can read them more up close, and you can see all the different resources that are available to you if you have an interest in plugging in with us. Aranda Roy, is an Indian author and a political activist involved in human rights and environmental causes. And I thought this quote really captures where the healthcare justice movement is at this moment in time. The system will collapse if we refuse to buy what they are selling, their ideas, their version of history, their wars, their weapons, their notion of inevitability. Remember this, we may be many and they be few. They need us more than we need them. Another world is not only possible, she is on her way on a quiet day. I can hear her breathing. I can hear her breathing too. It's time. We're at a dangerous tipping point. We must act now to save our public health programs by taking them back from the privatizers, expanding and improving them, thereby ensuring healthcare justice isn't just a dream, it is our reality. Si se puede. Thank you, everyone.